Jules, how are you?
Hi.
Pleasure meeting
Nice to
you.
meet you.
Absolutely. How are you? How's your travel from Minnesota? Yes? You like the weather here?
Yeah. Yeah.
Please take a seat. I'll see you guys soon. Right. How do you feel?
I'm excited to be here. So,
It's been a pleasure. So June, your story in less than a minute, if you can, please, for doctors who are always watching here.
I have extreme keratoconus or extreme myopia and nearsightedness, and even with my contacts and glasses, I don't see very well. And I needed cataract surgery and was intimidated, and I found Dr. Galani, and my doctor encouraged me to come here, and I'm excited.
My pleasure. Well, I think you want to say accompanying here.
No, I'm just, she researched online and found you, and we followed a lot of your work and are very impressed and have a lot of faith in what you do here. So we, yeah, I'm
We
just,
came here from Minnesota.
yep, we came here from Grand Rapids, Minnesota, and didn't know if we could make it happen, but we made it happen, and we have total confidence in what you do, just from what we've seen online.
I'll do my best. So we measured her right now. Doctors, you're watching this as any other Monday. Patients who are coming here from all over the world, and I've already spent hours yesterday, Sunday, as I meditate and plan, because before they come, their doctors send me the information. And now I've seen them. Here's a wonderful patient. She's traveled all the way from Minnesota. She has extreme keratoconus. Keratometry is in the 50s, and she has very high astigmatism. You can see 11.75, very high astigmatism and very nearsighted. Her axial length is 28.75, nearly 29. Very high myopia and very high astigmatism with keratoconus. And even though you can see the eye trace with 11.75, I'll show you the Penacam too, where you can see the profile of this eye. You can see that perfect lobster claw appearance of this keratoconus. And she has a posterior polar cataract, as you can see. So with all these levels of complexities, we are still trying to make sure that we give her the best outcome we can. So advanced keratoconus, high myopia, extreme astigmatism, posterior polar cataract, also fugues going on, and we are wanting to try and see how we can best give her vision. We are proceeding with lensoplastic. And as you know, all of our patients do their research. They do extensive research before coming here, and it's always my privilege that their own eye surgeons, whether anywhere abroad or in the country, like in her case, in Minnesota, have them travel here. And it's a huge responsibility to the patients, to their surgeons, and the fight is on. June? Look forward to it. I'll torture you once again, remeasure, and then you go. Okay?
All right. So
Pleasure.
Thank you.
Sure. Great. So here we are, rechecking everybody who has landed, and making sure I have all the data, all my planning, because lensoplastic is based on custom designing the surgery, but also optically canceling the anatomical abnormalities, right? Sure. There's a wonderful patient from Minnesota, and as you can see, extreme keratoconus, but it's stable, that we have seen stability, very high regular astigmatism. The cataract also is a posterior polar cataract, so we've got to be careful with our technique, and you can see, if you can look straight ahead, extremely high myopia with very high astigmatism and keratoconus, and we're going to do a lens-based cataract surgery, but lensoplastic principles. So all this intensity of measuring, remeasuring, while I have to still plan my anatomy and how I'm proceeding tomorrow, right? Pleasure. I'll see you in surgery.
Thank you.
Absolute pleasure. Sure. Good morning, June. How are you?
good. I'm emotional.
Huh?
I'm emotional. She just told me I'll see 2030.
Amazing.
Yeah.
How many years of blindness, June?
Well, I haven't been able to see well for 25 to 30 years, but I got my first glasses in 5th grade.
What options were you given before coming here?
Rigid Gaspar-Mulo lenses and glasses. I couldn't see even 2100. So.
You no crying, big guy. Yep. Grandfather of 15 grandkids, no crying. I love it. June, it's You can see the place today, patients from all over the world. For doctors watching, I let them watch live everything here to share with them, that not to say no to anybody. June here is a case of extreme keratoconus. Extreme keratoconus. Extremely high astigmatism with high myopia, with a posterior subcapsular cataract. Hand motion. 20/30 and without glasses. So doctors, this is possible. Please don't say no to people. Fight for them. Just fight for them. And they are amazing. Look at them.
With my contact, best I could see was 20/80 in this eye.
And now you're seeing without contact glasses.
Yeah, so.
No crying, big guy. Been a pleasure. Thank you. My pleasure. Your trip from Minnesota.
Yeah, we head home tomorrow, so thank you so
My
much.
pleasure. Let me take a look. Got chin over there next to the fan. Nice mic. So doctors, again, no evidence of surgery. Went through a 2.2 incision, lensoplastic-based, cataract-based surgery through her keratoconus, through very irregular astigmatism, through high myopia, posterior polar cataract, and here she is looking pristine. Sit back, please. Looks fantastic.
Hi, I'm June Larson. I'm from Grand Rapids, Minnesota. I have not been able to see well most of my life. I have severe myopia, nearsightedness, severe keratoconus, and astigmatism. I am at about a -15, and the best correction they could do for me is a -11, which meant when I wear my contacts, I could still only see 20/80 in this eye, 20/60 in this eye. And with my glasses, the keratoconus don't work for that, so I am much worse beyond 2100. And so I've struggled. I'm a piano teacher, and I haven't been able to see music very well for 25-30 years. So you learn to adapt, but it's gotten to where it's been too hard. I have had doctors, when I was diagnosed with keratoconus, say I needed to go somewhere else. I have went somewhere else and got in there, and they gave me an intern who I said, have you ever treated anyone with keratoconus? And they were like, I've read about it. And the second time I went, they gave me another intern, and he watched a video on it. And so I've struggled all the way through not having good care until later on. I did get some doctors who were very willing to help me, but I needed cataract surgery, and I knew I needed something extra, and I found Dr. Galani, but was still a little intimidated and overwhelmed with the process. Started off with my own doctor in Grand Rapids, and he was willing to work with me, but knew that would be a challenging case and that they wouldn't be able to get me to 20/20, but they were going to do the best they could. And then there were some struggles along the way, and I finally mentioned Dr. Galani, and they said, yes, you should go and get the best help you can. And so it gave me the peace to come here, and all the videos I watched with Dr. Galani, and just seeing all the patients get help with everybody who comes here has really tough situations. And he doesn't turn them away. He figures out the best thing to do. So I have felt totally confident in just doing whatever he says I need to do and do whatever procedure we need to do. We were hoping, he didn't think he would be able to get me to 20/20. And I was just hoping to get to 20/80 and then get some more glasses or contacts to help further correct it. But I would have been thrilled with 20/80. And I am day 2 after having lensoplastic, and they say I'm at 20/30 in this eye. So that made me very emotional, and my husband very emotional. And we're excited about the possibilities. There may be a second procedure for this eye, or we may just start with the other eye. And we are thrilled with the staff here. During the surgery, the staff all came and worked together very well. It just boom, 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 everything happened. They were very kind, but very professional. And I'm kind of laying there going, this is kind of crazy, not crazy scary, I'm just kind of like in awe of what this is just all happening, and it went very fast. It was a very pleasant experience. we had a lot of fun meeting all the different people. It's crazy. There are people from Australia, people from London, a young man from Colorado who was very entertaining to listen to, and a gal from Michigan. There were some from Tennessee, Texas. People came from all over the world, and they're coming for a reason. And they've heard good things, and they are getting results themselves. So.
Excellent. Very nice. No evidence of surgery, lensoplasty, patient with keratoconus with very high regular astigmatism and very nearsighted. Anything you want to say? You traveled back from Minnesota for your second eye. How do you feel today?
I feel really good. Both eyes are feeling the same. The last 7 weeks have been rough because I've been so blind.
Right.
Eye. And I mean, even for me, if we would be driving at night, if there was a sign here, I would see 8 to 15 signs.
Wow.
And if there were multiple signs, there were times where I was like, I feel like we're driving into a wall. You know, that's how bad it was. And I know this is a process because I'm pretty extreme. So, but just being able to go swimming.
Yes, with your 15 grandkids. In Minnesota.
I went in the pool for the first time, and it's like normally I'm so worried about losing my contact and not being able to see, and it's uncomfortable, and it's like I can see where the ladder is to get out. Even though my vision isn't perfect yet, I could see my ladder. I could see where my towel was. It was just fun, and I'm like, how much have I missed out on in my life? You know, so yeah.
Pleasure.
Happy. So.
Doctor, this is a keratoconus patient talking. Extreme astigmatism, extreme nearsightedness, distorted irregular cornea, with lens changes, polar cataracts. And we did her first time a month ago, right?
Yeah, 7 weeks.
7 weeks, and she traveled back from Minnesota for her second eye, which we've done just today. And here she is day on post-op. And how would you describe your experience here?
Oh, very pleasant, I use the word crazy, not in the
Yes,
scary sense. It's just like, whoa, what's going on? This is crazy that all this can happen, and you do, we're at ease when we're here. I don't feel stress here, and I can feel good about just putting my eyes in your hands, and I try to do what you say and not look down and all this stuff, but that's hard too.
So anything you want to say? You've been here second time for her for second eye?
No, just very relaxed, at ease, very confident just from the research she did and watching your videos, and yeah, just to see what's happened so far is just very pleasant, just good to see that it appears that she's going to be able to enjoy life a lot more now.
Yes, absolutely. And you met and made friends with all these patients from around the world right now in the lobby. Minnesota.
Yes, thank you so much.
How long till her next procedure?
She's done both of you. We're done. Let's finish.
No, you too, thank you.
Enjoy your 15 grandkids. Have a lot of fun with that vision. But Monday, call me that you reach home safe.
My name is June Larson, and I'm from Minnesota. This is my second trip here for lensoplasty. I have extreme nearsightedness and extreme keratoconus and astigmatism, and I have not been able to see well for many, many, many years. And so I knew that I'm going to need another procedure, but already my vision has improved dramatically. Coming here, you feel quite at ease because you understand that there's that Dr. Galani and the staff has the knowledge to take care of us and do what's best, and they treat us as individuals. And surgical suite, this time I could actually see in the surgical suite and see how cool it was. And but they're just so professional. Everything just is happening, and I say it's crazy. It's not scary crazy. It's just crazy at what's going on and what they can do. And we've met a lot of other patients here. I've enjoyed getting to know them and talking with them. And it's like today, especially, people were sharing things and they were like, "Oh, you felt that way too, okay?" And it was like we all even though our situations are all vastly different, we are experiencing some of the same thing, and just it's so great to see their vision improved and all of us having the hope that our life is better and it's going to get better yet. So very thankful.